Coming up today on Your Sastastic Life, we are kicking off Breast Cancer Awareness Month with our guests, Dr. Andrea Lamphiear and Dr. Rachel Preisser. They are both board-certified breast fellowship-trained radiologists who recently opened Iowa's only women-owned medical imaging facility in Clive, Iowa. Grace Breast Imaging and Medical Spa is the only healthcare facility in central Iowa that guarantees fellowship-trained breast experts will care for every patient. Buckle up. Here comes the sass.
Your Sastastic Life with hosts Trisha Rivas and Wendy Fredrigo.
Hello, everybody. We are so excited to have new business owners in Des Moines. We're so excited for you to share what you brought to our community.
Thank you.
So,
Thank you for having us.
We're
Dr.
excited.
Andrea, Dr. Rachel, welcome.
Thanks.
I love your sassy pink outfit. I think it's perfect.
Well, it's almost October, and I wear pink every single day in October.
Do it.
Yeah.
And that's the other thing I'm excited about. We get to kick off Breast Cancer Awareness Month with you. So I'm going to let you guys do the talking. First of all, I would love to know how you met.
Okay. So we met a long time ago. We're not going to say how long ago.
Yes, we don't need to
Long enough. We don't need to discuss
No,
that.
but we met when I was a fourth-year med student, and she was a first-year resident, and she taught me how to read chest X-rays.
At University of Iowa, we both trained. We were both at University of Iowa at the time, and
you know, you meet hundreds of people during your medical training. Most of them you don't even remember their name, but for some reason it kind of stuck. Like we jived. And then years and years later, she applied for a job at a place I was working. That didn't really pan out. She ended up moving. But we reconnected. And at the time we kind of joked, well, we should just open our own place.
Yeah.
Because, you know, there wasn't really a place in town that was providing care for women, breast care for women, the way we wanted to receive care as women, the way we wanted to practice as physicians.
right.
We were
We
like,
wanted to send our family and friends. Like we
Exactly.
were like, it's not exactly just right. And we joked at the time we should just open our own.
Right.
And then it didn't. Yeah, I didn't end up staying in the Des Moines area. Instead, I went from South Dakota on to Georgia. But so we had connected again then, and we just shared such a similar passion and just so many things. Like we'd mention something and both be like, yes, exactly.
Like, why doesn't everyone do this?
Right. So we already knew we would be great partners at that time. So
Yeah. So you went your separate ways.
Yep.
And then how did you connect again?
So life just kind of happened. I had a career change, and
so I moved to Georgia in 18, and then it was probably only about 6 months after we were there, my husband passed away. And I'm from Iowa originally, from Jefferson, and I hadn't actually been in Iowa for a really long time, but it's where I was, born and raised. I went to Simpson. I mean, I'm very local. And then he was military, so we were kind of all over, and military and medicine are hard to mix. So it was a challenge, and we went lots of different places. And we actually, after my fellowship, which was at Susan G. Komen Center in Peoria, Illinois, then we settled in South Dakota, and then almost ended up back in Des Moines, but decided to go closer to his family in Georgia, which was, I love Georgia. It was great. We lived in Athens, UGA. It was kind of like Iowa City, so felt right at home. But then after my husband passed away, it was tough, especially because we weren't really into the community yet. So I decided at that time it was time to get back home.
And you had 4 children?
4. My oldest is 12. So my youngest is 6. So at the time, it's been over 5 years now. So at the time they were 6, 5, 3, and 11 months. So I worked there for a year, but it was one of the hardest things I've ever done. And I just was like, what am I doing? Like, I'm too isolated here. I need to get home. So then looked into starting to get home, and I was looking at jobs. But again, kind of ran into the same situation where the place that I really wanted to work didn't exist in Des Moines. But I had to be in Des Moines because my mom's in Perry. So I had to get back closer, and all of my extended family. I still have all 4 of my grandparents. And so we wanted to get back. And Rachel and I, again, like she said, she was having some career change. And we were just like, maybe this isn't a joke. Like, let's create the place we want our friends and family to go. and let's make it because it doesn't exist here in Des Moines. And Des Moines it's surprising for a city of this size. As far as breast imaging, there just really aren't very many fellowship trained breast radiologists.
Yeah. So tell me more what fellowship trained means for this, as those of us
Right.
Yes.
whose brains
So
were not meant for the medical world.
no, that's okay. Most people have absolutely no idea what goes into being able to read a mammogram. So
Right.
Yeah.
after medical school, so we are doctors, first of all. A lot of people
Okay.
don't
Yeah.
realize that we're doctors.
The radiologists always sit in the dark room and no one
Yeah.
knows about us.
Yeah.
Yeah.
We're like, no one sees us. Like
Yes.
they don't even know we exist, really.
Exactly.
Yeah.
So first of all, we're not the people who take the pictures. We're the people who
Right.
look at the pictures and come up with a diagnosis. So we went to med school. After medical school, we do 5 years of additional training.
So med school's 4 and then
Yeah.
5.
And
Okay.
so of that, 60 months of training, most radiologists only get 3 months of breast training. That's what they are federally mandated to have, which is wild because a mammogram is the hardest imaging study to read. I'm not saying that because I'm biased. It truly
Yeah.
is. Because mammograms, each and every one of them is different. It's like a fingerprint. It's unique from the breast that made it. And so if you take 100 normal women, you line them up, every single mammogram is going to look different. Whereas if you take 100 normal, knee MRIs, they are going to look identical. So you have this like wide range of normal, and then you have overlap from normal breast tissue and the early signs of cancer. And so that's really hard to tell. And for most people only have 3 months of training and they're like going out there reading a mammogram. So, if you want to be really, really good at breast, you do a fellowship, which is an additional year focusing only on breast imaging.
The entire year,
The
every day,
entire
all
year.
day.
And it's not just about looking at the imaging. It's not just about reading mammograms and ultrasounds and breast MRI. It's also about learning everything you can about the disease process. It's about learning, what is my surgeon looking for? How can I, as a radiologist, help the surgeon
To make sure they
to
remove.
make sure they get, when they take the patient to surgery, all of the cancer is coming out.
Yeah.
So you really want a fellowship trained breast imager to look at your imaging if you have a cancer diagnosis, because it might not just be one site. It might be in the other side too. It might be other places. And interacting with the pathologist, the oncologist, like we interact with the entire breast care team, and what we put in our reports and what we look at and kind of go after, it really impacts what everybody else in the care team does. So it's really important, and that's that part of it, that coordination, the clinical coordination. You don't get that in residency. That is a fellowship level experience.
And you mentioned to me a statistic that I found quite kind of breathtaking,
Mhm.
that we are second in the nation for breast cancer rates.
So we're second in the nation overall for cancer rates.
Okay,
All cancer
all
rates.
cancer. Okay.
And breast cancer is the number one most common diagnosed cancer in Iowa. And then the even more startling thing is that we are the only state in the entire nation that has a cancer rate that's on the rise. So we're not in a good place, and it's getting worse.
So what do my first thought, my brain goes to, is it because of the farming? Is it the chemicals? Which probably plays a part, but what other things
Right.
do you feel?
I think like Rachel talked about, and particularly in fellowship trained radiologists, we are trained to read breast MRI. And I think that is something very important for high risk women too. And not just breast MRI, but just subtle changes on a mammogram. That maybe if you're not doing it all day, every day, then maybe you don't see those really, really subtle changes. And sometimes those are precancerous lesions. And if we can remove those and find those lesions, and take them out, biopsy them. Sometimes you do end up going to surgery to take a little bit more tissue around where we would do our biopsy at. Then basically we're preventing the cancer from forming because we take that precancerous or high risk lesion out of the breast and it's gone. So, and that is another benefit of having fellowship trained radiologists who this is all we do. This is all we look at all the time. And this is our passion. And this is what feel super strongly about. And that's another benefit. And in Iowa, obviously, this is really important.
And I think, when we look at all of the radiologists in central Iowa, not just the Des Moines metro area, but like a broader net, a congressional district, if you will.
Yeah.
There are about 90 radiologists, give or take, in any given year. Less than 5% have fellowship training in breast imaging, less than 10% are women. And when you look at the volumes that these centers are doing, anywhere from a quarter to almost a half of the studies that they're doing, it's breast. And so just looking at the numbers, most of the breast imaging that happens in our state is read by somebody who is not fellowship trained, who is not an expert. And so, the question is, well, are we missing those precancer?
Yep.
Are
Could
we
we do
are
a better
could
job
we do a
of
better job of that if we had a stronger workforce dedicated to reading this breast imaging? So that's a big component there, I think. We could, if we were catching things earlier when they were precancer, we could prevent them from going on to cancer. But breast cancer is a multifactorial disease. There's a lot that goes into it. Certainly environmental factors.
Okay.
Um, there's breast density, which is a whole other can of worms that we can open. But that's
Yeah.
an
Every
individual.
time I get mine, they're like, "You have very dense
Yeah,
breasts. We want you to
exactly.
come back."
And it's
Yeah.
kind of alarming. It's a whole nother topic, but
Yes.
So there's that. But a lot of people don't realize that they could be at high risk for breast cancer without having a family history. If you have dense breast tissue and maybe you were a little bit older when you had your first child, those two factors alone together could put you into a high risk category, in which case we don't want to see you when you're 40 for your first mammogram. We want to start seeing you earlier. We want to start seeing you for mammograms at 30 and MRIs at 25.
And the problem with that is that it's hard. Our primary care providers are busy and overwhelmed, and this is what we love. This is our area of expertise. But again, a lot of radiologists are sitting in dark rooms and we're not talking to patients. We want to get out there and we want to talk to our patients and we want to find the patients who are high risk. And we're very passionate about that. And I think you find in people who are fellowship trained, kind of a higher level of concern about being more proactive about that. The education, we feel really strongly, rather than, breast cancer and mammograms are scary and there's a lot of fear surrounding it. And we want to change that. And we feel like just having knowledge and education can really empower you and feel like you can take back some of the control
Yep.
and, just be able to like, you know what, I know I'm high risk or I know I have dense breast tissue, but I also know where to go and what to do about it. And that's what we really want to give to the Des Moines community. Take away the fear.
Well, and you're very intentional with how your office is set up.
Yeah.
Yes.
It's very welcoming and warm, and it doesn't feel
Thank you.
yeah. So talk a little bit more about that, and then also share with me the name behind the reasoning behind
Yes.
name.
Yes. So we started designing our center by what is going to make the best patient experience. Like, we have had mammograms before. We are the only imaging center in the entire state owned by women. And I think that shows up when you walk when you walk through that front door, because we know what it's like to be wearing a flimsy gown that doesn't quite cover everything, changing in a little alcove off a hallway where men are walking down, and you're already anxious, you're already feeling kind of exposed, and then the environment just heightens that.
Right.
Yeah.
Very
And
clinical and kind of sterile and
Yeah.
cold. And we just wanted it to feel
so
very
we want
different.
yeah, exactly. So we want people to feel welcome. We want it to feel like a nice place to be, not someplace you have to be, but someplace you get to be.
Yeah.
And someplace where, even if I'll be blunt, sometimes we have to have hard conversations.
Yeah.
We do tell people they have breast cancer,
Yeah.
and we do that every day. But for most people, that's one of the worst days of their lives. And I feel very strongly that it is part of my mission to make that awful experience less awful.
Yeah.
And there are ways to do that. And the environment's important. How we do that is important. And so we kind of started there. Like, what would we want in that situation?
Yes. So you also have spa services.
Yes.
So tell us about that.
Yeah. And I think that it's twofold, right? And we've kind of hit on both of it. Number one, people don't love to come see us. We are aware people don't
Yeah.
love to come see us for a
But then we're
mammogram.
nice.
Right.
Yes, you can't take it personal, but they don't want to be there.
That's right. And we do understand that. But we
Yeah.
think if we can change the narrative about this being a scary, unpleasant, not fun experience, maybe we can get more people to come get screened and potentially save lives by convincing that woman who's never had one to, you know what, okay, this is less scary and maybe I can also just get a facial and kind of relax that day. And we, as women, particularly in the age group where we should start screening, we're taking care of everyone but ourselves a lot of times. And we want to make it easier And we want to change it from what we say often is we don't want it to feel like healthcare. We want it to feel like self-care. Because
Yes.
getting a mammogram, it's
Mhm.
it is screening. You do it every year. And this is something that we should not dread doing. And maybe if we can get a facial when we get our mammogram, it'll just have a better overall
It's something I get that you get
experience.
to do.
Yes.
Exactly.
Yes. And changing how we look at it. Like knowledge is power.
Exactly.
Just like getting blood drawn.
Yep.
Like it's good to see the numbers
Yes.
and see the truth.
It's better to know the truth. Right.
Yes.
And I think that, and the other part about that, and you just kind of talked about that, is we want to find young women who are at high risk, and they're even harder to find. Every woman, our guidelines suggest that everyone should know by 25 what their risk level is.
Okay.
That's not happening. It didn't happen for us, and we're in this industry.
Yeah.
It just doesn't happen, and all providers are overwhelmed, and it's hard too because like where does that fit? Whose job is it to do a breast cancer risk assessment and find out what a woman's risk is? We've just decided it's our job.
Yeah.
Yep.
But how do we get to a woman if she's not supposed to come until she's 40?
Yeah.
High risk women may start as early as 25. So
Yeah.
how do we get to find these women? We don't have a chance. But if we have a spa, then we do. So we offer anyone who comes in to Grace to have a facial or any sort of spa procedure, then we're also going to do a breast cancer risk assessment so that those young women, we can find them and we
Yeah.
can get an individualized screening plan to help them feel like we know what to do. And if you are high risk, we're going to take care of you.
So like you said, that it's not just if you have family history.
Exactly.
So
And that's a huge myth that a lot of people think, or people will say,
Oh, it was my grandmother who had breast cancer.
or my grandma was gene negative.
Yeah.
And we say, well, we used to only test for 2 genes, BRCA1 and 2.
okay.
Now we test for 40 some genes. In 10 years, we'll test for 100, 500, who knows how many genes. So just because we don't necessarily know the gene yet doesn't mean you're not high risk still.
Yeah.
So that's one of the things. And even without a family history, like Rachel said, depending on when you have kids
Mhm.
and your breast density, you can be high risk even without any family history.
Yeah.
So we just want women to be aware of that.
The other thing I found interesting that you shared was about the whole, excuse me, the lovely world of insurance.
Yes.
And so we don't have to go down that rabbit hole, but I would love for you to share the laws that are in place.
Yes. Yep. So screening exams are really important. They're so important. The federal government wants everyone to participate in a screening exam if they are able, and that includes screening mammograms. So screening mammograms are federally protected to be covered without a single cent out of pocket for patients, which means that patients can choose where they go for their screening mammogram. They don't have to go to, this place that their doctor says if they would feel more comfortable going somewhere else.
Mhm.
And it's really important as a patient, as a healthcare consumer, to do your research and make sure that you're going someplace that's going to serve you best.
Yep.
So that's the screening side of things. Um, After that, if you need a workup, if you're feeling a lump and you have to, get a diagnostic mammogram or an ultrasound, or if you have dense breast tissue and you need a supplemental screening exam like an MRI, um, right now today, most insurance companies will cover it at a certain percentage or maybe not cover it at all. It really varies by plan. And particularly if you have a high deductible plan,
A lot of it.
it might be all out of pocket.
Mhm.
So we actually worked with the Iowa Army of Pink this time last year, and we consulted on the medical part of a bill that is now law in Iowa and will be going into effect January 1, 2025. And that law says that if you are here in Iowa with a commercial based insurance product, that insurance product has to cover any breast imaging. Screening, yes,
Even
but
diagnostic.
even diagnostic and supplemental imaging without out of pocket cost to you. So that's a huge win
Wow.
because we would see it all the time. We would have folks who would say not come in for additional pictures that we were recommending because they couldn't afford the out of pocket expense. People who wouldn't get that supplemental breast MRI because they couldn't afford the out of pocket expense, and then we would miss cancers because of that.
Yeah.
Cancers that were easy to see on that breast MRI. So this is going to save a lot of lives.
Mm.
unfortunately, there are some folks that it's not going to impact. So, anybody who has a federal based program like Medicare, TRICARE, federal law trumps state law. So, those those insurance programs are not currently going to be impacted. The other people who are going to be left out by this new state law are people who have private insurance. So, if they work
Okay.
for a large company and they self and fund the health insurance for that company, they're left behind as well. So there's a federal solution. The Find It Early Act is something that's been going around in the legislature on the House of Representatives side for a while now. And just a couple of days ago, it was introduced. A companion bill was introduced in the Senate. So
Okay.
we're trying to get the word out about that. Everybody, call your senator and
Yes.
say, hey, support the
No.
Find It Early Act.
Find
because
It Early Act.
Find It Early Act. That's
Okay.
what we're all about. So that's good news for Iowa. We're moving in the right direction, and hopefully we can take
Right.
it over.
And that's one of the things Rachel and I are very passionate about too, is it's very hard for us to see women not be able to afford the same level of care as someone else. Like that
Yeah.
really bothers us because we do see it very firsthand. And to watch a woman worry about the biopsy that she's going to have to pay for to find out if she has cancer or not is really hard as a provider. And we are going to do, I mean, not only the legislation, which is amazing, and we hope to continue to fight for that, but we also are establishing a nonprofit that we're getting going to help pay for women who cannot afford lots of different things. We want to use it for all breast care,
Yeah.
imaging, treatment. We're really passionate about it. So that's the other way we want to try and help people here.
I love that.
Yeah.
So tell me where the name Grace came from.
Yes. So first of all, the nonprofit is Giving Grace, which we love.
Yes.
Giving Grace.
Yes.
I wasn't sure if we were letting that cat out of the bag.
Yes.
Okay,
Yes.
Giving Grace.
Giving Grace. So when we decided to do this, we went out for coffee and we're like, let's just do this. And so we started writing down words, and we made a beautiful word cloud of all of the words that just
Hundreds of
resonated
words.
with us, with how we wanted people to feel, how we wanted
Our mission.
yeah, the mission,
Mhm.
vision, values, all of
Mhm.
that. We were just writing down words to kind of hone in. And when we got to the word grace, we both kind of got goosebumps and we just stopped. And we're like, well, that's it. Because whenever you talk about a breast cancer survivor or someone who's been diagnosed with breast cancer, the word that comes to mind is grace, because it's something that it's not easy. It's life altering, and um, we see this happen every single day with our patients, and they meet difficult circumstances with grace.
And it's hard to find one single word,
Yes.
that describes it all. Brave, stoic, calm, just still, I mean, I can't tell you how many women that you say you give bad news to, and their first thought is of someone else, not themselves. And I guess it's just what other word can you come up with that describes the way these women handle with news that is literally life altering
Yeah.
in that moment, and they handle it with grace. And I think it's just, I think most people who work in the breast cancer field would probably feel the same way. Like, women are tough. They're pretty amazing. And we just, like Rachel said, we hit it, and it was just
Yeah.
that's it. It's
And
perfect.
it's a hard thing to go through. Like
Yeah.
breast cancer treatment, even when we catch it early, it's
Right.
not easy,
Right.
but women make it look easy.
Mm-hmm.
And they go through it with grace.
Yeah. Well, I mean, speaking of that, here you are. You're a doctor. You're a busy mom, and life threw you a curveball.
Mm-hmm. I'm like,
what?
don't make me cry.
I
I'm
mean,
not crying. Yeah.
Well, what advice would you give to women? Because sometimes,
Right. I think for me, honestly, if my husband hadn't died, I don't know if I would be doing this. And it's probably one of the most fulfilling things I've ever done. It's very hard. We're not going to say, I mean, starting your own business in medical field is, wow, there's so many things that we're learning the hard way, I guess.
Yeah.
But it is so rewarding to feel like you have a chance to make a difference. And like I say, if Warren hadn't passed away, I don't know that I would be doing it. And I guess you just realize, like, take the chance,
Mhm.
follow your passion, just do it. And he always encouraged me to do it. He
Yeah.
always said, you care too much and you are too particular to work for someone else. You need to work for
See,
yourself.
you know what he was talking about.
He did.
Yeah.
And I was like, I don't think I can do that. I think that's too hard. But then after you go through something very, very, very hard, you're like, can't be that hard, right?
But it shows the importance that that's one of the reasons you came back here is because you knew you needed to be surrounded by family.
Absolutely.
And I think that's another thing women aren't good about asking for help.
Yes.
Try to do it all on their own. Try to be
Right.
tough. And we can be tough.
Yes. But there are limits to toughness. And I'd
Right.
say it would be so hard to do this on our own. Like
Yeah.
there are so many times where each one of us has been like, we have to quit. But the other person picks it up and
Right.
and keeps it moving
Luckily,
forward.
we're never on the same page about that. We're always like, we're like,
Yes.
yes, fine. Everything's fine.
Yeah. And I think having each other to lean on, having community, and that's the other thing. We have met so many amazing women entrepreneurs who are have been so supportive
Right.
in small ways. I mean, even just saying, wow, I love that. Like
Right.
that helps us go forward.
Right.
And so
And our
it's-
patients too, like,
Yeah.
or people who aren't our patients yet, who've just stopped in and they're like, thank you for doing this.
Yes.
Thank you for caring enough
Yeah.
to do this. And that
Yes.
means the world. I mean, that is so
And
great
you're
to
doing
hear.
something that hasn't been done here. So, like, you're the pioneers.
Yes, it hasn't been done anywhere. We were
Right.
looking
Right?
around the country. There's nowhere else that's kind of
Just
done
kind
it.
of crazy when you think like it's a mammogram, women do it every single year, but there's nowhere you can do a spa and mammo. Like it just seems like really, but
Mhm.
so we're hoping
Yeah.
people like the idea and
Well, I find it interesting because we've talked about it quite a few times on our show since Trisha and I are going through perimenopause, how little people and doctors were educated on menopause
yes,
and that we're finally like getting to learn more about that.
right.
Yes.
So again,
Menopause shows up on your mammogram.
Yes, it does.
it does.
It does. It does.
I always joke. I'm like, I think we could tell before a woman even knows.
And how does it show up?
So it can change your breast density because
just like everything else, everything goes crazy, including your breast tissue.
Well, I found out there's estrogen receptors in your shoulders. That a lot of women get frozen shoulder. Like it affects
Everything,
all the
Everything.
stuff.
whole body.
Yes.
So
So we see a lot of like fibrocystic change that gets worse, and we often are like, oh, are you noticing any symptoms yet? And they're like, well, maybe, and we're seeing it on their mammogram.
interesting.
So
My first image was just something in there shriveling up. That's what I feel like sometimes. I feel like
the opposite happens. They get
kind of
bigger.
right around the first part. Yes, everything.
yeah. It gets bigger before it shrivels up.
Yes.
Oh, it's sad.
Oh man. Wow. So what would you say is like what's your big why? I mean, you've alluded to it a little bit, but on the days that are hard that you want to quit, what's your why that keeps you going?
I've always wanted to do this.
Mhm.
Ever since I was little, I wanted to be a doctor, and I was going back over stuff, and I wrote my college admission essay about a family friend that died of breast cancer.
Mm.
She was diagnosed too late. She had the fight of her life, and we were in a kind of an underserved community, and I just have this question, like, what if we knew her risk? What if we had identified that early and she was getting screenings? Like, would she still be here today?
What if she
Um,
wasn't afraid? I mean,
Yeah.
we hear quite a few women who don't come because they are afraid
Yeah.
and who maybe know they have a lump and are afraid about what we're going to find. And I think we feel like we're doing this because we can actually make a real difference for women in central Iowa. And I mean, we hope beyond eventually because we just, if we can make people feel less afraid, feel safer, feel like there's a plan, like we will actually hopefully be able to save lives that way.
Yes.
And that's ultimately what it comes down to.
And listen to them too. I mean, I've had so many stories of young women who've been like, something's not right,
Right.
or I feel a lump, and my doctor says I don't need a mammogram, and I'm like, no, come in, like we will listen
Right.
to you.
Right.
If you feel something, we're gonna find it. Even if it's just normal breast tissue, we're gonna find it. We're gonna get you an answer.
And help
I
explain to you what it is and not just say it's fine, explain why it feels like that. Help educate.
But and even having that baseline, let's say nothing was wrong, but now you have that baseline to compare to in the future,
Which is always very helpful. Yes.
right?
yes.
Mhm.
Yeah. Wow. Well, I mean, I just hope, well, I'm sitting here selfishly. Our youngest daughter thinks she wants to be a radiologist.
Yay!
Amazing.
So she might just have to come
That's
chat
great.
with you.
Yes, come
She has to
chat.
come.
Yeah.
Yeah.
Yeah, she
Amazing,
needs
great.
to come visit with you guys.
Absolutely.
And that's
We need more sassy lady radiologists.
we need
Yeah.
more sassy lady radiologists. But I also want to make sure I point that out. Men can get breast cancer as
Right.
well.
Absolutely. So it's not as common, which is why we don't routinely screen men for breast cancer.
Yeah.
So average lifetime risk for a woman is about 1 in 8. So 1 in 8
Okay.
women will get breast cancer. That number is a lot different for men.
Yes.
But when they do have a concern, it's really important that they see an expert because it's more rare. Um, a general radiologist may only see a couple of cases their entire career, whereas a fellowship trained breast imager will see multiple cases a year. And so you really want somebody who knows, is this something that we don't need to worry about, like gynecomastia, or is this something that needs a needle? And this is something we're concerned there could be a cancer here. So, we see pediatric patients. We can see, little tiny patients, a year or two old. We can see teenagers. A lot of things are going on with hormones during that period. So both for girls and boys, we see a lot of teenagers, and we see men and women too. So we want everyone
Yeah.
to feel comfortable
Welcome and
in
comfortable.
our space and not have a barrier to coming in and getting the help they need.
And
Yeah.
not just with breast imaging, but men can do self-care too, you know? I mean, we would love for them to come in and get a facial or when their wife gets their mammogram, like, why not? Come and
Yes.
make a day of it. So
Now, okay, so I know that men, their muscle, don't they have, do they have, I mean, we're built different, right? We have more of the fat layer above the muscle. That's why not a lot of men have cellulite. I know this is not medical how I'm describing this,
Right.
but so if that's the case, if they have more musculature than we do, could it make it harder to see it? Is that the point? Like if they did have something, it might be a little harder to see.
So actually, we can see it pretty well.
Oh, you can.
Yeah. So because there is typically less breast tissue there and a little bit less of the fatty tissue as well, it's actually easier to feel
Okay.
than it is
For a woman.
on a woman, because on a woman you might have a little tiny mass growing inside a larger amount of tissue. It's harder
True.
to feel, which is why it's even more important to have the screening exam. The flip side of that coin, though, is that because there's not very much tissue between skin and the muscle underneath, it doesn't take much for that cancer in a man to become involved in those structures and become a later stage
could be
because
more
it's right
aggressive
there.
and
Because if you have involvement in the skin or involvement in the muscle, that bumps you up and it makes it a little bit harder to treat.
Yeah. Interesting. I will say the very first one I had, I'm like, to look down and see your boob squashed like a pancake is pretty funny. Like I was laughing. I couldn't stop laughing. And of course I wasn't nervous, but I'm
No.
like cracking jokes oh my gosh. And then like you plop it on there and I'm like, because I have a heavy, you're like, wow, how much does that weigh? Because I think I could even see like a weight or whatever.
Yep,
well, and
the amount of
that's
pressure.
right.
Yeah.
That's
Oh, it's the
how
pressure. I'm like,
yes,
"That my
yes.
boob weighs 10
Actually,
pounds.
that's really interesting. We should let people know, like, that's not
Okay, please
Yeah.
tell them because I'm
Yeah,
like,
we're not weighing
this
it.
is why I'm overweight. It's my big boobs. It's not my butt.
That's funny.
Yes.
Yeah, that's the pressure.
The
But
pressure, that's good to know.
uh,
So tell me more about women who have implants, because
yes.
Yeah.
tell me more about that. Can they still get a regular?
Absolutely. It's safe.
Is it harder to see? Like, what do you
Can be
do?
harder, and there are different places to put the implants, but we do have techniques to push the implant out of the way. I think people worry that we're going to hurt the implant, and there's a very low risk, but it's extremely low, and you would never want to avoid getting breast screening
Okay.
because of it.
Mhm.
And with 3D in particular, which is the tomosynthesis. So we used to have just 4 pictures. You take 2 pictures of each breast, compressed this way and this way,
Okay.
and now that we have tomo or 3D, which is the same thing,
Yep.
the tomosynthesis, there are multiple slices or multiple pictures that go into creating the image of your breast. So each of those 4 pictures, each of them has anywhere from, I mean, depending on breast size, it can be 20 to 80 slices
Wow.
in that one picture. And so with implants, it really does help us see around the implant, see behind it. So 3D is good for everyone, all
Okay.
breast densities, any person, even men.
Yep.
It's good for everyone, but it does really help with implants too.
Okay. I've always wondered about that.
Yeah. And I mean, I think there is a misperception that like the pounds of pressure that we put on there could pop an implant. And in my experience, the only time an implant has popped, been when the implant is
There's something wrong
not
with it.
intact. Like
Yeah.
we've been able to see on the mammogram from the year before, there was something about the implant that was looking a little bit different. So
It's extremely, extremely rare.
and
Yeah.
even that is extremely rare, and it's definitely not something you want to avoid doing.
Yes. So women with implants, don't be afraid.
Get your
Yes.
mammo. Yes.
Yes.
Yes, absolutely.
Okay.
So a lot of people don't know what breast density is. So that's a good place to start.
Mhm.
The only person who can tell you what your breast density is a radiologist. So it's not what it feels like on an exam. It's not what it looks like. It's not if you have large boobs or small boobs. It is, what does this look like on a mammogram?
Okay.
And so what goes into it is you have different types of breast tissue. You have fatty breast tissue, and that's actually a good thing. Your radiologist loves fatty breast
Right.
tissue because it's easy to see through.
And every woman has fatty breast tissue. It's not,
Yeah.
we don't want anyone to ever think
It's not based on your weight
It is
No,
not.
necessarily.
it
No.
is not.
Okay.
And so the fatty tissue shows up kind of a dark, dark gray. So it's really easy to see through because cancers show up white. The
Okay.
other types of breast tissue, fibroglandular, and there are lots of different components that get lumped into that, it shows up white. And so
Okay.
the more white fibroglandular tissue you have on your mammogram, the denser you are. We have 4 different categories of density. So fatty, scattered, heterogeneously dense, and extremely dense.
Okay.
If you're in those top 2, heterogeneously dense or extremely dense, you're considered dense. And you're going to get that letter in the mail that says you are dense.
Yes.
Um,
And we
yeah.
want to help educate women about that too. Like,
Yeah.
what does that mean? What do I do about it? Because it's like, why am I getting this letter and now what?
Or having to go back and then get a ultrasound.
Yes,
Exactly.
Uh-huh.
And that's something you can do. There are all these different options. In every woman, there's kind of a different plan for it. And we want to tailor it to you. So we would talk to you and figure out what's the best plan. Looking at your risk, looking at your breast density, looking at your personal preference, like how should we set up your screening plan, you know? And breast density, again, half of women are dense. So a lot of people are getting this letter. So it's not in any way abnormal.
Is it a genetic thing? Is it like
can
what
be.
what affects the density?
A lot of different things. So
Right.
part of it is just how you're made. And so there's probably a genetic component there.
Got it.
Yes. Right.
Component at the very least. But cystic changes. Like if you're a big coffee drinker, that can rev up your cystic changes. So that can. I would never recommend anyone gives up their coffee in order to affect their breast density. But hormonal swings.
Yeah.
Body weight, medications. There are all sorts of different things that can contribute to your breast density. Typically, if you're younger, you're going to be denser. And
Okay.
as we get older, we get less dense. But there are some women who actually get denser as they get older. So I kind of think of it as like trees. So sometimes some people are evergreens and
Yeah.
they start out dense and they just stay dense their whole life. Other people, they start out a little bit denser and they get less dense over time.
Mhm.
But it's just important to know what your density is.
Yeah.
And to know if you are dense, your mammogram, you still have to have it because there are things that we will only ever be able to see on a mammogram, like calcifications and distortions. You don't need to know what those words mean, but those are early signs
That's
of
what we're
breast
looking
cancer that
Okay.
are best seen on a mammogram. So you have to get your mammogram, but you might need to help it out because it's easy to hide a cancer in dense breast tissue.
So we use a lot of tools together.
Yeah.
And depending, I mean, it's actually so individualized, which I think is another thing a lot of women don't know. They think just mammo every year, that's all we need to do. But it really is, we may need to do additional tests. So
Mhm.
MRI and ultrasound, we use all of those tools together to look at the breast tissue.
So women who have already had breast cancer are in remission, or like what what is a reason why they should come see you?
So same thing that we were talking about before. So when basically after having surgery, especially if you've had a lumpectomy, it does make it harder to look through that tissue. It makes it
Okay.
even harder with a scar to see the changes of breast cancer potentially. So you really want someone who's doing this all day, every day to see those subtle changes and just know, oh, I don't think that's just a scar. I think there might be something more going on.
Yes.
Truly, a breast cancer and a normal scar from surgery can look identical.
Really?
And if you don't have the history that somebody's had breast surgery, you're gonna get, "Oh my goodness,
Right.
here's a breast cancer case coming through." But then if you know where it is, if we've marked it and we're like, "Oh, that
Right.
matches up." But you can also have it can go the other way where you get a false sense of security where you're like, "Oh, they had a surgery. That's
Right.
supposed to be there." And I've seen people pass stuff, where it's been like, "Oh, that's just the scar." No, there's a subtle change from the year before. Let's look
Just
at
wanna look
it.
really, really closely at
So
those scars.
if you've ever had a breast surgery, your mammogram's harder to read, and you want an expert reading it
Mhm.
because you don't wanna get poked every single year. You don't wanna have to get repeated biopsies
No.
for normal post-surgical changes, but you also don't want us to miss a subtle change that could be a cancer that we would wanna intervene on.
Good to know. Well, I'm just so thankful that you are doing this here, selfishly in our state.
Thank you.
Thank
Well,
you.
that is something that's the last thing, and then I won't have anything else to add. But really, I think we sort of said it, but we didn't really come out and say, like, if you in Iowa, in Des Moines is not a small city and it's growing like crazy, but we have a much less higher ratio of female radiologists and of fellowship trained radiologists. So that is something that we compared to other cities that are even smaller, Des Moines does not have as many. So again, we're trying to solve that by bringing Grace here. And anytime you come to Grace, you're going to have a fellowship trained radiologist. And if you want to have a woman do your biopsy, we want to be the place where you know you can have a woman do your biopsy.
Yeah.
And I mean, when you're shopping around, even if you're doing your homework and you're looking for somebody who is fellowship trained in breast imaging, um, half of the healthcare organizations offering mammograms here in central Iowa don't even employ one. And those that do have a fellowship trained breast imager on staff, they are one of many radiologists who are going to be working. So
So you're just not
you're kind
sure
of
who
taking a
you'll get.
chance. Is that
Yeah.
person going to be there on that day? The only place to be guaranteed that you're going to get fellowship trained breast imager is with us
Yeah.
because we only hire fellowship trained breast imagers, and it's important.
Yeah. So can someone do a fellowship? Is there fellowship opportunities in Iowa?
Yes, University of Iowa has fellowship for
Okay.
Yeah.
breast imaging. Mhm.
Okay. Everybody out there who's wondering what they want to do with their life, this
Yes.
sounds like an area that's needs
Needed.
It is
Yes.
needed.
Needed. And
people.
come home to Des Moines.
I will say that when you're doing that research, it can be tricky because some people will say that they are mammo specialists.
Mhm.
And all that means is that they have met minimum requirements from the FDA to be able to read a mammogram.
It
So
can mean different things depending
it
on.
can mean different things. So you want to make sure that they've listed a breast fellowship.
Okay.
Yeah.
Good to know.
Buyer beware.
Yes.
Mhm.
Well, thank you. Your space is beautiful.
Thank you so much.
Absolutely beautiful. I already scheduled my appointment in November,
Awesome.
See you then.
and I can't believe that I'm excited to go get a mammogram, but I am. So beautiful, very peaceful there, welcoming. Um, and we're excited to spread the word about you.
Thank you.
We appreciate
Thank you
it.
so much for having us.
Yes.
Yeah.
Thank you.
Bye, everybody. Get your girls checked.
Your Sastastic Life is produced by Apex Creative. Go to apexcreative.vip. That's APEXX creative.vip.